Hi, I'm Dr. Mitch Roslin. I am a professor of surgery at the Barbara and Donald Zucker School of Medicine at Northwell Health and the director of the Bariatric Surgical Program at Lenox Hill Hospital in New York City and Northern Westchester Hospital in Westchester, New York, both part of Northwell Health. A lot of times people have told me, I'm healthy, but I need to lose weight. I often wonder what that means because how do we measure health? If you ask me, many of my patients think that health is measured by the absence of being on medications. The way I would define it is the ability to do things. For example, the ability to do 20 push-ups, the ability to run 3 miles in under 30 minutes, the ability to climb a tree, the ability to get off the ground. Most of our patients define it by the absence of being told by a chronic medical condition, and that actually can differ by who their doctor is. The truth of the matter regarding obesity is, imagine that we're going to go car shopping today and we see a car that was a 2020 car that's only 3 years old, but it has about 80,000 or 90,000 miles on it. We probably would be a little concerned about the degree of usage. And that's exactly what happens in obesity. When you are obese, basically have an increased amount of sympathetic pump. Your heart's beating slightly faster, your blood pressure's slightly higher, there's an increased amount of glucose turnover. You can almost think of it as the furnace is always on, that the body is being overheated. And just like any mechanical part, the more stress of it, the faster it burns out. So if you look at all of the major chronic diseases that we think of old people getting, cancer, heart disease, dementia, even COVID-19, they tend to happen earlier in obese people. Everybody knows that New York became the central focus of COVID right after it began in April, May of 2020. And we noted that people who were old were passing away. The other group that we saw that expired earlier were the obese people, and we actually did a paper on it. It showed there was almost like a 10 to 15-year phase change on it. So that an obese person who is 60 behaved as a non-obese person in 75. And I think that's true across the board. When you look at all chronic healthcare conditions, they just become more likely at a younger age. So the way I think of obesity is a marker of accelerated aging. And I think we all want to try to live as healthy as we can for as long as we can. And I think a lot of that begins with a diet and an active lifestyle. And in bariatric surgery, what we can do is give you a very effective tool to make that likely. Thank you very much for watching this video. And if you like this video, please subscribe to our YouTube channel, where our goal is to provide the most objective and unbiased educational information regarding bariatric surgery.